Dr. Stanford, first, thank you for what you're doing, and help us understand why there's so much distrust about a vaccine among the Black and Latino communities.
Thanks so much for having me. So first, it's more that the healthcare system has been untrustworthy to African Americans. And I think that's where you have to change the narrative, because long before, in the 1800s, when there were surgeries performed on African women without their consent to perfect the procedure before it was done on white women, for example. And of course, everyone knows Tuskegee, but then there's Holmesburg Prison in Philadelphia. There are the Henrietta Lacks cells with the HPV. And of course, now we're living through coronavirus. And so those fears are genuine. They are predicated on experience and real life actions that happened. So that's where it stems from. And some of the younger generation, they don't know those stories, but it's something that's passed down culturally from generation to generation.
Well, the CDC director, Robert Redfield, had some new comments speaking to the larger issue of trust in a vaccine. I want to play those.
One of the biggest challenges we have right now is to maintain confidence in this vaccine. And I do think the FDA is really looking at the rigor to make sure that they really turn over every stone to look at this data to make sure they understand fully what the safety profile is, what the side effects are, so that there can be transparency for the American public when they do approve this EUA for this vaccine.
Well, we want to.
I just wonder, and not being critical of Dr. Redfield, but is transparency going to help even those folks that we saw in the piece with Lester Holt, who are going door to door to people in their own communities and saying, listen, I did this myself. I mean, how do you change this narrative, doctor?
So I do believe transparency is key. I said, you're not going to be able to change 400 years of experience, quite honestly, in the next 4 weeks because there's a vaccine that you want everyone to take. I believe you need to say, this is the fastest we've ever developed a vaccine. We want those who are most vulnerable to receive it because your death rates and disease rates are higher. The risk for you is the same risk as it is for white America. We know the immediate effects, some of the intermediate, but we do not know the long-term effects because it hasn't been around long enough to be studied, but everyone is assuming that risk. And yes, we're going to take it, but we have trepidation as well, but we're trying to maximize the benefit and reduce the risk. And that's true for everyone.
So, look, there are people who are thought leaders, who are respected, folks out there who are trying to make the point that you just made. And I want to play what President Obama is saying about this.
If Anthony Fauci tells me this vaccine is safe and can vaccinate, immunize you from getting COVID, absolutely, I'm going to take it.
And then, Doctor, President Obama went a step further. He said he'd take the vaccine publicly. President Bush, Clinton both said they would do it in public if they thought it would help. And there's a new op-ed in the Washington Post calling on President-elect Biden and Vice President-elect Harris to get vaccinated live on TV as a way to encourage minority communities to get inoculated. Do you think that could have an impact?
I do believe it'll have an impact. However, I think there's about 3 groups of people. There are those who are going to take it right away. And most often, those are the people who have been impacted. We know that 1 in 2 African Americans know someone who's been seriously ill or died from coronavirus disease. And those folks, the risk is worth the benefit. There's the folks that are kind of the wait and see. And then there are the people who have had the disease that have long-term antibodies that want to know that this vaccine is going to be better than the naturally acquired antibodies. I think, yes, President Obama, absolutely. President-elect Biden and Vice President-elect Harris, yes. But you need the on-the-grounds community leaders that people know and recognize and interact with to also say, yes, it's safe.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.